Hello, everyone. We're here to discuss about the approach of management of facial nerve palsy. So, when we are dealing with a case of facial nerve palsy, I should ask myself some questions. The first question is if that facial nerve palsy is isolated or not? Is it acute onset or not? Acute onset over 1 day, 2 days. The third question is it unilateral or bilateral? Lower motor neuron type or upper motor neuron? And I should do further detailed history and examination. If all that questions are positive, is it isolated, of acute onset, and unilateral, not bilateral, and of lower motor neuron type, and the history and examination not suggest other causes of facial nerve palsy. So I'm dealing with isolated facial nerve palsy, or also called Bell's palsy, with a management. When I am managing a case of Bell's palsy, I should ask myself about the duration. If the duration more than 7 days, so corticosteroids will lose their benefit. So just eye care and follow up with GP. If the duration is less than 7 days, so I should prescribe a prednisolone of a dose 1 milligram per kg for 1 week, and also eye care, and then follow up with GP. When I am following up with GP, the GP should know that that information. The information is when the symptoms still beyond 3 weeks, so should refer to pediatrician. When the symptoms persist for more than 3 months or more than 6 months, up to 6 months, the GP should refer to pediatric neurologist. So when I should refer to pediatrician, I should refer the case of facial nerve palsy to a pediatrician if the symptoms persist more than 3 weeks, and also to pediatric neurologist if the symptoms persist more than 3 months up to 6 months. When we are talking about other causes of facial nerve palsy, I should know that when any of that is negative, so I should consider these symptoms. So HIV, there is an association between HIV and facial nerve palsy or seventh cranial nerve palsy. Facial nerve palsy disorder is the most common cranial neuropathy associated with HIV infection. So, as I said, facial nerve disorder is the most common cranial neuropathy associated with HIV infection. So I should consider HIV regarding symptoms, regarding history, regarding investigations, because, as I said, facial nerve palsy is associated with HIV infection. And also Ramsay-Hunt syndrome. Ramsay-Hunt syndrome is a triad of facial nerve palsy and otalgia and facial nerve palsy, and the vesicles of the external auditory canal. So I will notice the facial nerve palsy, and ipsilateral vesicles on the external auditory meatus. And the facial nerve palsy is here is a lower motor neuron type. Lower motor neuron type. The third cause is Lyme disease. Lyme disease may be suggested by the history from as the patient is coming from or just coming from woody uh, area as Scotland, or by the history of erythema migrans, that lesion of Lyme disease, and the Lyme disease I should examine joints. I should examine joints. Also, in case of chronic otitis media, that will be excluded or proven by history and examination. Trauma and trauma, I should exclude temporal bone fracture in case of history of trauma. Stigmata of temporal bone fracture should be sought in the presence of history of redness of trauma. Yeah. And neoplasms. It will be suggested if I examine the patient. I found the history of weight loss, and I found history of manifestation suggested neoplasm, and the last is herpes simplex infection by the history of or presence of vesicles of uh, herpes simplex virus. You know, as I said, I can find it, and yeah, that image with vesicles of herpes simplex virus and facial nerve palsy, and also uh, in cases of facial nerve palsy, there is some loss of sensation in the first two thirds of the tongue. And regarding the medications I use no medications except if corticosteroids and duration less than 1 week, and also antiviral may be useful in cases of herpes simplex virus, and also herpes simplex virus is cause of Bell's palsy, maybe just Bell's palsy. I should differentiate between the uh, 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 upper motor neuron or lower motor neuron region. Examination of pinna and external auditory canal and tympanic membrane, as we said, to exclude Ramsay-Hunt syndrome. And also, we said about follow-up, and I should refer the GP. GP should refer the case to a pediatrician if the facial nerve symptoms persist more than 3